Alright, it's been 42 hours since the earthquake. I'm here with Josh and Greg. We got separated from the rest of our class. Here's Josh.
I don't know if anyone's still out there, but Mom, if you see this, the med sim was really the breaking point for me and I had to drop out. Do you hear that?
Yeah,
Do you hear something?
Do you hear that?
I don't hear anything.
Oh, someone's yelling for help. We better go.
We're coming!
Oh my god. Oh my god. Oh my god. There she is.
Anymore. Oh, help me, anyone, please. Oh, 10 out of 10 pain. I cannot even handle it.
Here, take my blanket.
Thank you.
Wait, first we need to get that log off of her.
Okay, I'm gonna cover your lower extremities, okay?
Okay, it just hurts so bad. Get me out of this. I don't even...
All right, guys, ready?
All right,
One, two. Here, let me cover you up. Are you cold?
Oh, freezing.
Do we have a first aid kit?
Before we get the first aid kit, we need to assess you first, okay?
Okay.
Can you tell me who you are?
Bethany Hernandez.
Do you know where you are?
I'm in the Nevada wilderness.
Okay. And do you know what happened to you? Can you tell me what happened?
Well, I was just trying to go down to the river for some water. I'm so parched.
Okay, all right. And can you tell me what's hurting? What's wrong?
Everything hurts. I heard a bunch of cracks. I think my body's broken.
Okay, anywhere in particular that you want us to look at?
My upper and lower extremities.
Okay, all right. Greg, you want to look
Let's
at
go
those?
ahead and look at it. Oh, his arm looks a little deformed. Looks like it may be
Ow!
fractured. A
Ow!
little tenderness. All right, how about this leg? Does this leg hurt
Oh!
at all? Yep, that
Ow!
one looks like it might have some tenderness and fracture.
Oh,
Is there any swelling?
How about a little bit of swelling? Not too bad. How about this one?
Ow! That
you-
hurt
All right.
worse.
All right, looks like she's got some fractures. We should probably splint them before we move her.
Am
Are
I
you
gonna
able
die?
to move at all?
No.
Okay, Bethany, I think you have multiple fractures, okay? We're gonna try and move you, but first we need to splint your fractures, okay? Josh, can you go find some debris, please, and that maybe we can splint her fractures with?
Okay, I found some. Alright, so it looks like she has multiple fractures. Let's get her legs on one of
Stabilize
these.
that leg first.
I'll use this for her hand.
All right, Bethany, we're gonna move you, okay?
Okay.
No more towel. We're gonna use the towel to drag you up, okay?
Prepare yourself. It might hurt a little bit, or a lot, but
Oh no, really?
yes.
Yep.
But you can scream as much as you want, okay?
Okay, we gotta do this, okay? Ready?
Oh.
1, 2, 3.
Ah! Ow! Why would
more.
you do that?
Okay, we're
That
gonna
was
drag
so
you to
painful.
safety.
No, probably a little bit more.
No!
more?
No more! Please stop it now!
little
Just
bit
leave
more,
me!
okay?
Just leave me!
2, 3.
Ow. Ow.
Okay,
Oh,
we're gonna
ow.
drag you to
Ow.
safety, okay?
Oh God, just end it now! Oh! Oh! Oh, are we safe yet?
Yeah, we're safe now. We're gonna assess the different types of fractures that you could have, okay?
All right, I got your jacket. I'm gonna put it under your head, okay?
Okay.
What are you thinking, Greg? What kind of fractures do you think they are?
So I'm thinking this one on the wrist, it could be an impacted fracture. It could be caused by like falls while she tried to catch herself.
Okay.
If you look here on the x-ray that I found, it would look kind of like this near the wrist.
Okay.
Okay.
And then what about the right leg?
The right leg, it could be a comminuted fracture, is where the tibia gets broken into more than 3 pieces.
Oh, that sounds painful.
So the only way we could fix this would be a surgical intervention. Where they go-
Surgery?
Yeah, but that's not going to happen.
Not now. After
No.
that earthquake.
World.
Oh
Okay.
my.
And another fracture over here on the leg. I don't think it's a spiral fracture, but it could be. This is more prevalent in children and twisting motions and whatnot.
It
and
could have
this
happened when she caught her foot between the branch.
Yeah.
I
we
did this
found her.
weird twisty thing and then I heard a snap.
And then over here could be a green stick fracture on the radius. And this is also more prevalent in children because the bones aren't as hard as adults, but it doesn't break all the way through. It kind of looks like it got stuck through.
Okay.
So I think with the impacted and the green stick, it could probably be fixed by getting a cast or something. But other than that,
Am I gonna be okay?
maybe if we find some medicine.
I hurt.
Some of my notes from our patho class before the earthquake struck, they survived. They're a little burnt, but your fracture over here, the comminuted one, it's a direct fracture, so you have to have surgical alignment.
Oh no.
Unfortunately, we don't have any doctors right now, but it's done by when the bone breaks, you get either a screw, a plate, or a rod that's going to fix it together and bring those ends together, and the metal stays in there permanently, and it makes the structure for healing. There's no callus, which is I'll describe in the indirect healing.
Okay.
Does that make sense?
Yeah.
Maybe learning about this might make it a little less stressful.
Yeah, I'm pretty stressed right now.
I'm sure you are. Well, up here, you can see you've got some bruising up here.
Oh.
That's the healing process for indirect. That's the natural process of healing. So this is actually your body trying to heal. It's it's in the first stage, the hematoma. So when the bone breaks, it breaks some of those blood vessels that are on the outside of your bone and causes this big bruising and swelling. The damaged ends of the soft tissue bleeds and clots, causing this hematoma directly next to the jagged edges, which causes the immune response, which is the white blood cell influx and the vasodilation and the increased vascular permeability. Then it's going to move into the fibrous network formation from that hematoma. And then it moves into the osteoblasts come in and and then the collagen strands will stretch and lengthen, and calcium deposits will go in and lay that groundwork for that new bone and make it a little bit stronger. And then once the callus forms, new bone is built, and the osteoclasts come in and get rid of any lingering dead tissue. And then you've got your new bone.
Oh, that sounds easy.
Yeah, it's not too bad. And this is usually the worst part.
Yeah, it hurts pretty bad.
I'm sure it does. We're gonna try and get you some medicine soon. Josh is looking for something to give you.
Oh good, I need something strong.
Yeah, I'm sure you do.
Yeah, 11 out of 10.
Yeah.
It's unimaginable pain.
Oh, I'm sure. You seem a little bit calmer now, though.
Oh no, I'm just holding it in.
Maybe just going into shock.
Maybe.
Alrighty. Hey Josh, have you found anything? She's hurting pretty bad.
Alright, I found this first aid kit. This is all we have to work with.
Alrighty. Let me move over so you can get in there and help her.
Nothing in there.
There's not a lot in here.
Oh gosh, I'm gonna die.
Okay, the first thing I'm gonna do is put on my gloves.
Oh god.
Hang in there, Betsy. We're gonna give you something that's gonna make you feel better, okay?
Oh, big pain.
Alright. You have a deep laceration on your scalp, on your forehead. So we're gonna
feel it.
take care of that first. You might have lost a lot of blood.
Oh, maybe it's all becoming such a blur.
Alright, I only have this
What?
little band-aid.
What is that small thing gonna do?
Alright, let's stop the bleeding for now.
Oh.
The next thing I'm gonna do is flush your line.
What?
But she doesn't even have a line.
Was that water?
Let me check. We have an alcohol pad, and the only thing we have is naproxen sodium.
Is that an ingredient?
So I guess this is our only option. Alright, because Jessica talked about the inflammatory response with you, with the increased vasodilation and increased capillary permeability, this is our only medicine that we're working on. So at least for your bone healing, this will help with that by stopping the inflammatory response.
So does it stop the pain?
It'll help with the pain a little bit, but NSAIDs work on a pathway, which is the cyclooxygenase pathway. It's abbreviated COX-1 and COX-2. So COX-1 works with prostaglandins in your stomach to help with mucus production and stomach acid control. And then COX-2 is what happens with the inflammatory response. So because naproxen sodium with my research is a non-selective COX inhibitor, it should help with the inflammatory response.
You say so.
There's nothing in my notes about how to give or how much to give her though.
I would just start with the standard dose. There should be some instructions on the back. What do they say?
Well, if I remember, there is a ceiling effect with NSAIDs. And that if you just give 800 milligrams, it doesn't matter how much you go past that, it's still gonna work the same. So NSAIDs also have some properties with stopping platelet aggregation. So there are some risks for bleeding.
What?
But these are the best option for us so that the inflammatory response goes down and so that you don't go into septic shock, okay?
Okay, if you say so.
I remember having a lecture on this, but I can't really remember the adverse effects or if there's any black box warnings about them.
Wait, I think I remember something like that.
So this is
Hello, I am your faculty, Professor Hernandez, and today we are going to talk about NSAIDs as a drug class. So we're going to go ahead and start with nursing considerations. So before you give this drug as a class, you always want to assess any allergies or drug interactions that your patient may already have. You want to do a head-to-toe assessment for their pain and always go through the old CARTS mnemonic. Next, you're going to note any interference for ADLs, and lastly, you're going to ensure that the drug is not expired and that it is safe to give. Now we're going to go ahead and go over a few quick facts of NSAIDs. There are 23 different types of NSAIDs, but aspirin is the most commonly seen one in the clinical setting. And the reason these NSAIDs are so popular is because they have analgesic effects, anti-inflammatory properties, and they are antipyretics. Next, let's go over the adverse effects. So, adverse effects of NSAIDs as a drug class. You can see GI ulcers or hemorrhages, age-related macular degeneration, tinnitus, bronchospasms. It might increase your risk for MIs or strokes. It can give the patient heartburn, nausea, vomiting, abdominal pain, epigastric distress, and much more. Now let's go on to risk factors. So patients who have any of these should not be taking NSAIDs or should be taking NSAIDs under very close monitoring. So if your patient has a known drug allergy, probably shouldn't have an NSAID. Or if they have any condition that can cause the patient to bleed out, probably shouldn't have an NSAID. Vitamin K deficiency, peptic ulcer disease, pregnant and nursing moms, no NSAIDs. So lastly, we're going to cover the black box warnings for NSAIDs as a drug class. Ketorolac specifically we're going to talk about, you should have this drug for 5 days maximum. This is because any more, it can increase your chance for fatal cardiovascular thrombic events like MIs and strokes. Ketorolac can also cause peptic ulcers, GI bleeds, or perforations. Don't use these drugs for patients who have renal failure, pregnant or nursing, peptic ulcer disease, or if they have recently had a GI bleed. Now, if you can remember all of these facts, you are safe to give NSAIDs as a drug class in the clinical setting. Have a good day.
It's been 76 hours. We were hit by an aftershock. Josh and Greg are dead. Bethany bled out. I'm the only one left. I'll come back if I can, but I don't know. I'm hiding under this table. I don't know when I'll be able to make it out.